Hello everyone. Dear first year BDS students, I hope you're all doing well in your first year course. You have got anatomy, physiology, biochemistry, and DADH. It's already been so many months, and I assume that you're comfortably placed. But in compared to all the three or four subjects, generally anatomy is the subject which people find little tough compared to others. It's a relative term. Please understand that there is nothing called toughness. There is nothing that we cannot achieve. But compared to other subjects, anatomy is slight difficulty in level. It is little higher. So are you the person who is having difficulty in anatomy? If yes, then you are at the correct place. If are you the person who is finding difficulty to understand anatomy, then you are at the correct place. If you are finding difficult to remember the names of the branches, right, arteries, veins, lymphatic drainage system, the concepts, and not able to understand the relations, then you are at the correct place. So hello everyone. This is Professor Dr. M.S. Balakrishna here. I am Dean Academics and Professor and Head of Department of Oral and Maxillofacial Surgery. So dear students, I have been teaching anatomy for the last, I think, 18 years, 17 to 18 years. And that too also in a very quick time, we will be doing it. So all the students who have registered for the program, I would like to assure you that just trust and just do what I am telling. I will assure you that within 20 to 30 days, you will be exam ready, provided that you are following all the instructions. So today's class is just basically I want to discuss with you rather than putting some PPT and then going around the PPT. So I just want it to be a live interactive class. All your doubts, queries, everything you please put it in the chat box and our executives will reach out to you. Right. So dear students, first of all, anatomy. So as you know that anatomy is the study of the human being. So basically, being a dentist, we have to discuss or study this part, that is your head and neck. So only head and neck we need to discuss. In head and neck, again, we have got different subjects. In anatomy, you have got gross anatomy. So where you will study grossly. Then you have got embryology, very important, histology, neuroanatomy, and osteology. So basically, one subject of anatomy consists of 5 different subdivisions, and each of them are equally important. So before we go into how to study anatomy, what to do, so let us know what is the marks distribution. Now in 100%, a question paper may be a 70 marks or 80 marks or 100 marks or 500 marks. It doesn't matter. Whichever pattern, whichever university you are in, please understand that gross anatomy accounts for 70%, 70. So gross anatomy, 70% weightage is there. So it's a very, very huge amount. But what if I read only gross anatomy? Is it sufficient to pass an exam? Definitely not. You read 70%, you will reproduce only 50%, and you may get only 30-35%. So definitely you should do and go beyond what is required. Next. So your gross anatomy 70%. Then comes your embryology. Embryology accounts for around 15% of the total weightage. Marks distribution may vary here and there, but it's 15%. Then 5% osteology, 5% histology, and then remaining 5% your neuroanatomy. So in all those things, the questions are very clear. Generally, we have a question bank. Your 90%, 90 to 95% of the question paper, what you're going to get is there in our table right now. But the only thing is which are those questions we need to know. So anatomy should be studied. So first step, in an integrated and a well-planned manner. You cannot read something one X here, Y there, Z somewhere else, this chapter, that chapter, this chapter. So that is a very, very wrong method. You have to go from easy to tough topics, right? So that is how we should start. So this is the BDS first year program, live anatomy program, whose introduction I am taking now. So today after the session, what we'll be doing is, right now I will just discuss a timetable what we are going to follow. So after this, once this program gets over, I'll give you 2 days time to think, and then we'll start the real program. So in the real program, first is we have to prepare ourselves. So we should know the basics of anatomy. So first 2 or 3 classes will be basically focused on the basics. That is branches, vascular supply, nerve supply, all those things. Who is branch of what? With lot of mnemonics. Okay, so many mnemonics will be given. You will love it. You will start learning anatomy like anything. Just have confidence. It's been 18 years I am teaching, so it is easy. I'm telling you, generations are over. It is very, very easy. Only thing is the mindset needs to be changed. Oh my God, anatomy is tough. It is not at all tough. So first 2 classes or 3 classes will be of the basics, purely basics. And I do understand that as a student level, we don't know anything. So I'll start from the zero. And whatever you have studied, if any confusion is there, just take it out and throw it out. Start from zero. With mnemonics, with systematic approach, we will learn that. And after that, we will be discussing and starting the gross anatomy. The gross anatomy. In the gross anatomy, there are 14 chapters, 1 4, which starts from your scalp, temple, face, parotid gland, submandibular gland. Then you have got neck, anterior triangle, posterior triangle, back of the neck, larynx, pharynx, mouth and pharynx. Like that, it goes on. Ear, tongue. So like that, each one is a chapter. So first thing is, we should know why are we studying these chapters. See, you're going to become dentist. So this part you are the master. So that is why you are studying nose, mouth, ear, tongue, right? Like that. That is why you are just concentrating towards here. And half of the students don't know why they are studying that chapter and what is the clinical implication. Now, for example, in the scalp chapter, all of you would have studied. The scalp chapter, the first layer is skin and then superficial fascia. And we have got hairs. In the skin, first layer, we have got hairs. Why are we studying hairs? I am a dentist. Why should I study hair? So, dear students, a dentist, after passing BDS, and then you do maxillofacial surgery, you are entitled to do hair transplants. Hair transplantations you can do. And then the second layer, superficial fascia, it tells us that a lot of fat is there, all the vessels, muscles, everything is there in the second layer, superficial fascia. So if a person is full chubby, we can remove the chubbiness. We can make the person, a 60-year-old person who's having lot of wrinkles, we can make them very young. We can make them almost like 30 years. A 60-year-old lady can look like 30-year-old. That is through facelift procedures. Who does it? The maxillofacial surgeon and the dentist does it. They can also, plastic surgeons do it, but maxillofacial surgeon being part of dentistry, they are also entitled to do. So this is what, when you study something, you should know why are we studying it and how I can implement in my life. And why I am studying this, how it will affect other diseases. Because it's not only first year. You have to study second year, third year, final year also. So in all those years, how these are interconnected, I will give you the complete picture about that. So over a period of time, we'll start loving anatomy and then we'll go further. Right. So dear students, we all want to be successful in life. Yes, everyone wants to be successful. There is no person who doesn't want to be successful. Everyone wants name, fame, money. People should recognize. Right. Wherever you walk, people should notice you. So that is a basic human nature. But it doesn't come automatically. You have to work hard for it. So please understand, if you work hard, this 4 5 years, your BDS 4 5 years, then you can enjoy your next 40 50 years. If you waste this 4 5 years, then you'll have to struggle more for the next 40 50 years. So the choice is yours. Work hard now or later. Right. So it's better work hard now. This is a study period. And always you should be exam ready. It should not be like when exam is on 15th till 14th night, you're studying without any planning. So it becomes completely pathetic. You should never panic in the exam. So when we start our anatomy program, what we'll do is we'll try to finish. It's a 2 months program. 2 months means 60 days. In that all 60 days, there will not be class. There will be class on alternate days, something like that. So most probably you'll have around 30 class, 20 to 25 to 30 classes, right? So within first 20-25 days, you will feel that yes, I have passed anatomy. So first gross anatomy will be doing it. Please understand that. So how this program will change your life? So first and foremost, we will change all the learning patterns. I will interact with all of you. Today, it's in a big platform, but when a class is there, cut down classes, we will be seeing each other. We'll be interacting with each other. And you'll have to take me like your friend. And what we'll be doing is, I'll be knowing your names. Individually, I'll be talking to you. The timing of the classes will be according to our will, right? And then we can grow mutually. So what we'll do is, first is the study pattern needs to be changed. How study pattern will be changed? You have been studying in school till now. So studying in school is one way of studying, and studying in a professional college is entirely different. The mistake people do is they continue to do the same study what they did in school life, and they try to replicate in the college life. So a lot of hard work they put, and the results are very, very, very less. So what happens? You're putting hard work, you're not getting the results because you're going in the wrong direction. The methodology is wrong. And once or twice in internal exams, when you don't score, the whole motivation goes down. So a child who was very good performing in the school, in the professional college, he is not at the same level. His quality comes down. And after a period of time, just he studies for pass mark. Who was a ranker in the school is just studying for the pass mark right now. This is all because of lack of planning and lack of smart studies. So you should know how to study perfectly. There are a lot of what you say methodology. So during the course when we start studying, I'll be giving you scientific methodology how to remember things. Right? One method of remembering is like by hearting. But how much will you by heart? First year anatomy, again second year, third BDS, fourth BDS. You can't keep on by hearting books, and reproduce and top the exam also. That is impossible. By hearting is out of question now. In schools and all, it is okay. Few chapters, 8 chapters, 4 chapters, you can do. But here it is impossible. You cannot by heart anything. So that pattern I will be changing. Right. So you will remember things with a new scientific methods. What are the methods? I will tell you in the classes. Right. So we'll have mnemonics. We'll have image-based visual remembrance technique, audio remembrance technique. So there are a lot of techniques which will help you customize to your anatomy. So it will really help you out. So you learn by visual stories also. A lot of stories I will be telling you, like X and Y, we're going for a trip, X met Y. So in that way, what will happen? Then I will connect the real characters. You just remember the story, you will remember the whole chapter. So it's so beautiful, I'm telling you. It is completely a different hack of studies, okay? So we'll do smart hacks also. How to decode everything from the question only, and how to interrelate. So this things looks for the very first BDS, what I'm talking now, little different, but yes, this is all possible, right? And then the real tip for exams, we'll have continuous exams, written exams. So once you write the written exam, you will send the question paper in our app, and you have all the study materials, everything will be your lecture classes, your notes, everything will be there in the app, and live classes will be there from my side where you'll be talking to me. Yeah, I speak almost 7 or 8 languages. I speak Hindi, I speak English, Malayalam little bit, Telugu. You can speak to me in any language. So that is one thing. And then this live interactive classes, what I will do is we will discuss few chapters. Once few chapters are over, I will pre-assign a date for you, which you can share with me, discuss with me, and then we'll have a written test on that day. Only those portions will be covered in the test whom we have discussed. And I would, while teaching also, I will be telling you this is the main question, this is 5 marks, this is 3 marks, or something like that. So that will be live. Along with the live in the Eden2 app, you will be having recorded classes also. So night 2 o'clock, if you want to learn submandibular gland, just go and click. You can learn submandibular gland. So in fact, those classes are recorded by some other faculties. So you will be having best of two faculties, one live mentor and one recorded mentor who is there in the app. So you'll have live interactive classes, real time questions will be there, and then chapter wise and what you say important questions will be discussed in a sequential manner. No random topics. Study notes will be given to you, which is there in the Eden2 app. Mock exams, evaluation. So these mock exams are very important. So constant exams will be happening, right? A written exam, and your marks will be discussed only with you in no public platform. It will be discussed. It's only individual, right? So this marks will help you to know where do you stand. See, it's very important. Suppose in your college you're having a college day or annual function, and you want to sing in the annual function. But my dear friend, if you cannot sing in your room, you cannot sing in your room, then how are you going to sing in the annual day stage? Very difficult. So if you don't have confidence singing in your room, you cannot replicate that in the stage. Same way, if you cannot perform in small micro exams, it will be very difficult to perform in the final exams. So we'll prepare you with all micro exams, systematic approach, right? So do mistakes and how to draw diagrams, what is the speed it should be. Generally 3 hours exams it is. And people get a booklet of 50 pages. So how to utilize this 3 hours? How much time should I write a main question? How much time should I write a short essay? How much time should I write a short answer? Diagrams. How much time should I devote? It's only 180 minutes, 3 hours. One diagram you can draw for 1 hour also, or you can draw in 1 minute also. So what should be the speed? How much labeling is required? So all those tips and hacks we will be discussing. And some diagrams out of blue you have to imagine and draw also. So during our course of discussions of our classes, I will be telling you. See, now we are discussing this. Which diagram from some other chapter, not related, which can be drawn here also. So some related, interrelated things. So what will happen? Our mind will open up. We will start thinking not like a chapter, not like a textbook, but like a life we will be seeing. How it is there in our body. See, this anatomy is what study of human beings. Who are the human beings? We are the human beings. So you don't have to search anatomy somewhere out. It is inside you. You just need to learn yourself better. That's it. Nothing more than that. It's damn easy. So mock exams and evaluations are very, very important. I promise you, if you do it this, let your marks will be 0 out of 100 in the first few exams. No problem. But that is the time where you will really come up to the peak level. And there will be guidance, expert guidance will be there, mentorship will be there. Not only one person, there will be multiple people who will be supporting you. So you have got general anatomy, head and neck, neuroanatomy, histology, embryology, which I have already told you. So this is just a breakdown of the course. Dates vary. Please do not go as per the exact date. This is the timetable. Dates vary here and there, right? So we may be in some other day of the what's there in the calendar. It doesn't matter at all. Whatever is there in the timetable, we will be finishing well before that in schedule. And what we'll be doing is in a very easy manner and very slow manner. Now many people will have some doubts. Sir, college mein they are teaching for 8 to 10 months. You are telling you will teach in 2 months. So superficially you will do and finish it. No, here, there, and you will finish it up. So many people have that doubt. I'll tell you, we'll go into depth of each and every chapter. But you should know how much to read, where to stop, how much to learn, and how to learn it easily. So we'll be saving a lot of time by studying in an easy manner. So 25th May is the time. Today is 21st of May, right? So 25th May, we will be starting this. All the details, again, it will come in the WhatsApp. Duration is 2.5 months. 2.5 months is too much for us. Actually, program is for 2.5 months. We will finish in 1.5 month, and then we'll do constant revisions. So please understand, our support system is not just to finish the portions and go out. It's not like that. Till you write the exam, till you pass, we are there with you. Right? We are there to mentor you, support you. We can be there till you enter your exam hall. But in the exam hall, you will have to perform. So you'll have some mentors. This is myself, Dr. Balakrishna, and then you will have Dr. Jyoti and Dr. Aparna K. Babu. These are your mentors, right? So every time if you are not able to reach me, but live class I will be there. You can ask me doubts and questions. Everything will be very easy. I will be asking you, did you understand? Did you understand? If not, we'll repeat again and again and go. So these are the mentors. So generally we'll start with gross anatomy as I told you. So first week we'll start with introduction, then blood supply. These are the introductory classes, maybe 2 classes, right? One or two classes, 2 to 3 also. And I will give you time to read and come for the next class. It's not that every day class is happening and you are not getting time to read for the other class. It will not be like that. Our classes may be alternate days. So you will get time and very small portions. So please understand that you should be ready to study and you are the ones who are going to have exams. So you have to follow me. I will not be fast, but you will have to do the things what I tell you. So this is basically the introduction when we gear up for the anatomy. Then week 2 to week 5, this is where the maximum thing will be done and dusted, right? So it is just for timetable sake. So this is the skull osteology. This will go little back actually. Gross anatomy we will be doing first. So all the gross anatomy chapters, side of neck, anterior triangle, parotid, each one are very easy chapters. They look huge when you study in a college because 1 year of teaching. Here is just 1.5 months and beautifully done. So like this, first the gross anatomy gets over and you will be writing after every 2 or 3 topics, you will be writing the micro test also, right? Maybe 1.5 hour test and then evaluation and then you go for the next, like a unit test, it will be happening on a continuous basis where you will be told prior, after 10 days, you are going to have a test. So these are the questions. Please prepare that. And we would have already discussed those questions like that. So once the gross anatomy gets over, then we will enter into embryology. Right. So embryology again, I told you 15% is embryology, very important. So we will be doing embryology. Again in embryology, Inderbeer Singh, there's a book called Inderbeer Singh. That is a very standard book which people follow. It's like in medical people also follow that. Even though if you are reading some other books, there is no problem. For gross anatomy, BD Chaurasia, standard book. But there are other books also in the market. You can read that. BD Chaurasia is the traditional book, very easy book, very simple book actually. That is more than enough to smash anything. So for gross anatomy, BD Chaurasia. For embryology, Inderbeer Singh. Histology also, Inderbeer Singh, we can read. Osteology, it is there in your Chaurasia also. And there is a book called Poddar, Poddar, small book. If you don't have, don't worry, I will be giving you notes. So all in the PPTs, it will be there. So there is nothing to worry if you don't have the textbooks. But BD Chaurasia, if you have, your life will be very easy. I can assure you, you will be learning it in a faster manner. But if you have other book, no problem. Still you learn from here. You can replicate. Answer is required. From which source you're writing answer, that doesn't matter. You should understand and reproduce. That is very important. Then once your gross anatomy is over, embryology, histology is over. So almost like our 80-85% of anatomy is over. Then after embryology, we'll go for histology. Histology, we have some 15 to 20 slides which repeatedly come in the exams. So those slides will be given to you and you can learn that in and around that slides, discussions will be there. And then the last section will be your brain, neuroanatomy. This is little difficulty wise little tough, so we have kept it towards the end. But the percentage of marks is less. So you don't have to study in the beginning and waste your time. Later you can do this. So this is the last week. These are the topics. each chapter, all of the important things, everything in an interrelated, easy manner, it will be given. Right. So embryology is before all those things. That's what I told you. This is subject to change. Histology. So our order will be gross anatomy, embryology, osteology, histology, and neuroanatomy, like this. And then once we have finished with anatomy, we will be studying embryology. When we are reading embryology, revision series of anatomy will be always on. So once the embryology is over and you are in histology, the revision series of anatomy and embryology will be on. And that chapters will be told prior, a whole timetable will be given to you. So what will happen? It's not that you're studying now and again you have to revise. Once you start studying on topic, you're always on for the exam. So it is always on your brain. So what happens after a period of 1.5 month? Whatever I have learned today plus whatever I have learned till now, everything I remember. I don't go into panic mode because what I have studied 20 days back, I don't remember. We are in constant revision pattern and flow. So that is how we get results. So by 1.5 months, repeatedly reading, revising, writing exams, we will be achieving our goal. And then there will be last question bank discussions also. Question bank discussions, what are the important questions from each chapter, which we already would have discussed, which we already would have written in the exam. Again, that will be discussed in a rapid fire round. So this is just the studies. But only studies will not help. You should know how to present your paper, how to present your answers. So your 3 hours, how to write. Time for main question, short essay, short answer. Each question we will plan it up. And then how many diagrams to be drawn and how much quantity, 50-page booklet, how many pages to write for main question, short essay and short answer, that also we will be discussing. So what will happen whenever we are writing our mock test, we'll follow the same pattern. There will be no way. You will just follow the same pattern again and again. I told you, if you cannot sing in your room, you cannot sing there in a college day stage. So same way, now in our home, when we write the test, once we follow the same rules of the university, definitely we can reproduce much more faster, much more better in the final exams. So dear students, this is it. So starting with an introduction class, which will be announced in the WhatsApp group. I hope all of you are there in the WhatsApp group, right? Our executives will come in contact. So those who are interested for this series, right? You can get enrolled in the WhatsApp group. The flyer is there. Okay, so get into that. So the total course is actually 5,999, what I have been told, right? 5,999, but it is coming for 3,999. Okay, so it's almost like 3,999 the entire anatomy course, just 4,000 rupees. Okay, and over a period of 2 months, it is not one class, two class. You're not paying per hourly class. It's not per monthly class. It's for the entire portion till you go and clear this exam. So it's 3,499, 3,499. It's not even 4,000, 3,500, 3,499. So this flyer is there in your WhatsApp groups, right? Our executives are there. So please speak to them, get enrolled, and then we'll start the class the day what I announce, maybe by tomorrow in the WhatsApp group. We'll announce it and we will start the classes. Definitely you will be having many more queries, many more doubts. Whatever you have, please post it in the WhatsApp group. All of you are there in our Edin2 WhatsApp group, right? So you contact us. I will personally handle all your queries, and if you are satisfied, then only you can join. And for the beginners, the first 2 classes, you can take it like a free complimentary class, right? Where the basics are taught. You will see how I teach. Now you're hearing only what I talk, right? How I teach, first 2 classes, the basic class, right? But that why basic class free means at least your basics will be pakka. You join, don't join, that is secondary thing. But your basics will be pakka, which will help you, and you will really appreciate that you have taken a decision to learn something. which will help you to pass your exams. Tomorrow, when you become doctors, anatomy is the basics. Without anatomy, you can't do other subjects. So, if the basics is strong, your life is safe. So, whatever 2 hours you will spend with me, it will not be waste. So, basic classes, first 2 classes, it's a complimentary. You can get enrolled for that. So details of the class and everything, it will come very shortly in your WhatsApp group. Okay. So that's all for the today's session. Have a beautiful day. Bye bye.